saying about that.
Hi.
Yeah.
How are you? I have a patient who has an order for a CT scan this morning. She is pretty weak, and she can't transfer from a chair to the test table very easily. So I think we should send her down to the CT scan on a stretcher. Is that correct?
That's fine. Being on a stretcher will make the transfer to the exam table a lot easier. Okay. What do you need, Mark?
I'm just going to get the transport stretcher, a bath blanket, and a regular blanket.
Excellent. Remember to be very careful when moving the patient from the stretcher to the bed or the bed to the stretcher to prevent injury to the patient or the staff.
Okay.
We have Anna. Let's take Anna and go move your patient.
All right.
Down here?
Yep.
All right.
Mrs. Garrett?
Yes.
Hello.
Hello.
They're ready for you in the CT scan room for your exam.
All right.
We're going to take you down on a stretcher. This will help in transferring you to the exam table so you don't have to climb into it.
Okay.
Okay. Ms. Lewis and Anna, another nursing student, are going to assist me.
3 people? I'm not a beached whale, you know.
No, of course not. This is just a little complicated, and we want to make sure that you're as safe and comfortable as possible.
Okay.
Can I take a look at your ID bracelet? And can you tell me your full name?
Betty Garrett.
All right. I'm just going to raise the bed to a comfortable working height so it's even with the stretcher. Okay.
Yeah, that's good.
And I'm going to lower the head of the bed till it's flat.
Okay.
All right. Lower the side rails. Now I'm just going to use the draw sheet to move you to the side of the bed that the stretcher will be on. Okay. 1, 2, 3.
Now, place the bath blanket over the patient and remove the top covers from underneath.
All right. Now we can move the stretcher next to and parallel to the side of the bed. Make sure that the stretcher's wheels are locked. And the bed is locked. All right. Okay, now we can take the pillow from the bed and put this on the stretcher. Thank you.
Where do you want us in this?
Well, if you two can just stay on the stretcher side of the bed, and I'll work from this side.
Okay.
Okay, now just kneel up on the bed.
Okay. Keep your knee at the upper torso, closer to the patient than your other knee.
Okay, now I'm just going to roll the draw sheet as close to the patient as possible before grasping it securely and transferring the patient. Okay, now, Anna, if you can grab the draw sheet at the patient's head and chest area, and Ms. Lewis, if you can grab the draw sheet at the patient's waist and thigh area.
Okay.
Okay, Mrs. Garrett, we're ready. If you could just fold your arms across your chest for me. Thank you. Okay, now on my signal, you two pull the draw sheet, and I'll lift the patient from the bed onto the stretcher. Okay, 1, 2, 3.
Switch your head here. Okay.
Okay, you comfortable, Mrs. Garrett? Everything's all right?
complaints.
All right. Now I'll just cover her with the blanket. And I'll leave the draw sheet in place for the return transfer.
Great. Nicely done, Mark.
Thank you. Okay, Mrs. Garrett, ready to go.
Okay.